Health Information Technology for Economic and Clinical Health Act, HITECH, was designed to promote the adoption and meaningful use of health information technology. Healthcare facilities are required to report performance in care of patients with common conditions that require hospitalization, including heart failure, myocardial infarction, pneumonia, and surgeries. Using an electronic record enables the organization to accurately capture and report this information to regulatory bodies. We've talked about the laws that govern protected health information that are embedded in the HITECH law, and now we will talk about the electronic record itself. As use expands to smaller organizations and private or public health practices, problems have been identified, particularly with the option of choosing a variety of systems that may not talk to each other, thus impairing the rapid and effective use of health information from one provider to another. Security, reliability, and accuracy are ongoing issues that we will discuss in this week's readings. The electronic health record is a longitudinal record of the patient's health information generated by one or more encounters in any care delivery setting, and it is an electronic version of the patient's paper chart with medical information from one provider practice or healthcare facility. The electronic health record, or EHR, is able to be customized to meet the needs of the patient and the healthcare provider and the organization. Additionally, the information gathered in one location has the potential to be made available to multiple providers across the healthcare system through a shared network. The electronic health record can be adapted to meet the needs of different types of healthcare facilities and providers. Under the HITECH Act, organizations are encouraged to adopt the electronic health record and quality for incentive payments. The meaningful use legislation was introduced in 3 stages with the long-term goal of the creation of database systems that are able to maintain complete and accurate information about patients in a way that improves access to care and empowers patients to have a role in their own healthcare information. Other benefits that are still being implemented are the streamlining of documentation and the ease of access to information in an electronic health record. Finally, the EHR allows for information to be entered at the time of the activity, for example, vital signs, a physical exam, nursing care, and for easy retrieval of that data to guide decisions about care needs. Decision support tools are embedded in the electronic health record to aid in the provision of safe care. They provide alerts and reminders for medication administration and ensure that orders and care is legibly documented in the record. Another advantage of the electronic record is that the record may be continuously updated and information retrieval is almost immediate. Information may be available at remote workstations for providers and ancillary staff. Evidence-based practice is integrated into the electronic record through embedding of nursing protocols, admission risk assessment tools, plans of care, and clinical practice guidelines and order sets. Finally, as previously mentioned, the electronic health record allows for accurate collection, aggregation, and reporting of information required by governing bodies that support both quality care and provide information that supports community health initiatives. Informatic systems are often built independently of each other, which introduces the inability to communicate with other systems. Companies compete with their system designs, and a major reason that systems can't communicate with each other is a failure of system designers to adopt and use common terminologies. To address this issue, the International Health Terminology Standards Development Organization has introduced a multilingual clinical healthcare terminology called SNOMED CT that can be incorporated into software applications. Other reasons for interoperability is the competition between vendors, which makes them reluctant to share data, and the need for unique patient identifiers to prevent errors that occur when different systems utilize different identifiers for the same patient. Additional challenges occur when the system is introduced in the clinical setting. Workflow patterns are changed, and staff are often stressed by the initial added time to complete computerized documentation. Providers are often reluctant to adopt computerized provider order entry into their practice, which creates even more stress for nurses who can no longer accept verbal or phone orders from a provider. Potential errors include juxtaposition, which means that the item is selected that is adjacent to the intended choice, and that creates an error. Orders may be disorganized in their presentation on the screen, and staff may eventually get used to and ignore the system alerts, which are embedded to notify staff of potential risk. There are many other challenges that impact an organization's ability to effectively implement and use an electronic health record. Costs include the initial fixed cost, licensing fees, and expenses necessary to maintain the system. Organizations may need to prioritize implementation timelines based on their financial and staff expertise. Performance and security concerns must be considered as a system is designed and implemented. Technical safeguards include effective encryption of personal health information in a way that both protects the patient information and restricts access to those who need to know that information. The system must be built in a way that prevents improper alteration, destruction, or transmission of the health electronic record. Finally, a method of ensuring that data can be collected during periods when the system is down. Staff must be trained on how to manage documentation during these periods of downtime. Successful implementation of the electronic health record requires a willingness to learn new technology and to embrace that opportunity. Being willing to address issues in a positive manner with the attitude of improvement, not complaining, is a key way that nurses can positively impact the implementation and success of the system. Often organizations will ask for volunteers to serve as super users. These staff take additional training in using the system and serve as a resource for all staff as they attend education and begin using the system. One of the greatest challenges is to keep the patient, not the computer, as the prime focus of care as documentation moves to the bedside. Placing the computer so you can maintain eye contact with the patient while documenting, and remembering that the patient is first. The computer is a tool to help you document the care you are providing. Review the information in your text on additional strategies that can help you make the computer work for you and for your patient.